Hey, Trinice. Hey, Miss Terry. I'm waiting to see if a couple more people will join. Um, just want to talk about what I experienced for the COVID. I've been diagnosed with COVID. Um, so I wanted to talk about my experience with being diagnosed with COVID-19. Um, so I'll see if anybody else joins in at all. I'm trying to do this pretty quick while my little one is sleeping. She was also diagnosed tested positive for COVID-19 as well. So I'm trying to do this while she's sleeping. All is well. I guess I basically start with what I experienced with being tested and testing positive for COVID-19. Tested positive a week ago on June 11th. I'm actually self-isolating right now at home. I experienced a lot of, I want to say, racial ill treatment from the hospital when I tested positive as well from COVID-19. I'm just really trying to gather my thoughts because it's really important, I feel, that we know our rights. Not only know our rights, but know that we have to advocate for ourselves, or at least have a person to advocate for us when we are in medical distress and we are unable or incapable of basically advocating for ourselves. So I tested positive for COVID on June 11th. What led me to even go and get a test, I believe I was exposed at work. I am a children's social worker with DCFS. And I went to a really filthy home. When I say filthy, I'm talking about animal feces, urine, trash. They hadn't had trash service for over a year. The home smelled horrible. There were dirty dishes stacked and piled up, gnats and flies and stuff in the home. There were tons of plants of marijuana throughout the home as well. And it was a referral I went out on with my colleague. So I had a mask on. The only thing that they had given us was a blue surgical mask, is what we call it, as a part of our PPE gear. Gloves are the only two items that we've been given since this COVID-19 pandemic. And later I found out that it wasn't enough to protect us. So with that, I went to that home, did an investigation. We were out there for over 8 hours trying to make a plan for these children so that we didn't have to detain or take these children into custody. Basically, we were trying to wait for grandparents to show up, which tons of people came. It was over 15 people came to this house that we were exposed to in order to make a plan so that these children were not removed from their families and taken into protective custody with DCFS. So with that, I remember coming up out of the house as we're consulting with our supervisor, and basically I felt like I could not breathe. But ultimately I thought it was because this house was so disgusting that I'm just like, oh my God, this is just gross. I can't breathe, because even with that mask, it was not enough to shield from the smell of the home. period. There were 3 tiny tinies in this house. And, we have to do what's best. We have to do our job in order to ensure that these children were going to be safe before we left. So basically, I remember coming out saying, oh my God, my chest is hurting. My chest is hurting. I'm taking deep breaths. I'm just like, oh God, I need fresh air. We wind up conducting the last 3 hours of our investigation and planning for the children outside of the home, because the home is just that nasty. Moving forward, I rush home, and shower. I still feel like I can't breathe, like my chest is still hurting. And I shower, I'm in a breathing in steam's starting to make it feel better. Just thinking, okay, it's just, I inhaled a lot of dust maybe, or something like this. Is just, never once did I think COVID-19, ever did I think about that. I started having like horrible headaches that night. The headaches persistently became worse, over a couple of days. Until I woke up Wednesday, June 10th, with like severe body aches. My body hurt so bad to the point where my scalp was pulsating. Like everything was hurting. My ears was pulsing because my head was hurting so bad. So I just decided, I said, you know what? I'm just going to make an appointment to go get tested for COVID. I don't know like what made me think to do that, but I just like, oh, and then I also heard rumors at our job that a couple of people had tested positive for COVID and it was never disclosed to employees. So that was whole nother issue. And they were basically just sent home just to kind of like, I don't know, wait for it to die off. I don't know. But we were never informed. But I did hear rumors that people at my job, they also had previously tested positive for COVID, but it was never confirmed by administration or anyone like that. So I said, what the heck? After what I experienced, not being able to breathe at this house, I could have been exposed. Let me go get tested. I tested that morning. I actually scheduled a test for the next morning on Thursday. Again, I woke up with the same body aches. That my head was just progressively getting worse. And after I went and tested the next morning on June 11th, through the LA County 211 site, where you can schedule for the local testing facilities. So I tested in Palmdale, and of course we don't get results 3 to 5 days later. So that, I just tested that morning. Well, that morning before testing, I dropped my baby off, who's 5 months old, at childcare. She appeared to be fine to me that morning. She had ate fine. Everything, appeared to be normal. But I received a text message later while I was at work that my baby had a fever. And at that point, it was like 99.9. We're thinking, oh, it's just teething. Basically just give her, 2.5 Tylenol, 2.5 mLs of Tylenol. And then after that, she should be fine. Well, a couple of hours passed and her fever had spiked. It jumped to 101.8. My childcare provider's like, hey, this fever's not breaking. I think, you should probably, check it out. I was like, okay, I'm going to come get her as soon as I can get out of the field. I'll come and get her. I wasn't able to get her till like close to maybe 4:00 that afternoon, where her fever was still progressively getting high. It, at this point was almost 102. So, I picked her up from childcare, took her straight to Kaiser. Kaiser would not swab her. But they opted to swab me after I explained to them I had just tested that morning, LA County. I'm a social worker. I'm still in the field. They opted to still test me at Kaiser, the Kaiser facility. She was deemed to, my baby, 5-month-old baby, was deemed to have a slight right ear infection, is how she put it. They said, well, if you test positive, then we'll swipe her, but there's no need to swipe her. Her fever, by the time we got to Kaiser, was registered at 100.8 from their thermometer. So they gave her amoxicillin, sent me home on my way. I, explaining to them about my headaches, everything. They were just like, okay, continue to monitor it. You'll get your results. We'll see what happens and go from there. Thursday and Friday, because of how everything was going, I decided to isolate myself and my baby in my room. I constantly wore a mask with my children. Even being around them, I wore 2 masks with my children. And Thursday night into Friday morning, all the way up until Saturday, I self-isolated in my room with my baby. So basically, at that point, I still continued to have body aches and like terrible headaches. My 5-month-old baby continued to experience 2 days of fever that would not break with Tylenol. It would not break at all. The highest register was 102.8 on my thermometer at home, with that fever going into Thursday, Friday, into early Saturday morning at 3 a.m. By this time, that was the last time I gave her Tylenol, was on Saturday at 3 a.m. So after that, she appeared to be getting better. However, I was getting worse. So that morning, I had to leave my room. I had to give my baby to my oldest daughter, and I had to head to the hospital. Checking into the hospital was a nightmare. Of course, you're met at the door at this point. I didn't know I was COVID positive. What I thought I was experiencing were not COVID symptoms. I have experienced in the past what's called intracranial hypertension, which I'm very familiar of the symptoms. I had it in 2013. I was hospitalized after the birth of my second youngest, and I knew the symptoms. I knew what I was experiencing in my head. I didn't believe it to be COVID-19 symptoms. I had the pulsing in my ears. I had the spots in my vision. My head literally felt like it was going to explode. I felt like blood was going to start coming out of my ears. Like, I was in so much pain. I get to the hospital. You're asked the typical COVID questions. You get the screening at the door for a fever. I didn't have a fever. I was escorted in. I was sent to the green zone. I went to the Antelope Valley Hospital. I was sent to the green zone, and basically when I was telling him I am in pain, I had to walk to the green zone, and I'm pretty sure most people have not been to the Antelope Valley Hospital, but I think it's a long walk from the emergency department to the green zone, from the back of the hospital to the front of the hospital, to be in pain. My pressure was high. That didn't mean anything to them. I waited forever in bed too, waiting for the doctors to come and assess me. And I'm literally in tears at this point. My head's pulsing again. I'm explaining. By the time the doctor came to assess me, I explained to her what's going on, what I believe it to be intracranial hypertension. I believe I need a CAT scan. I believe I need a lumbar puncture to have this fluid released from my brain. I have fluid on my brain. I'm explaining this to them. I get the side eye. I said, I'm in pain. I need something to relieve the pain. I get the side eye, basically like as if I wasn't being taken seriously. Oh, you're sensitive to light, right? Is the question that I get, very condescending, from the doctor. And I believe she was even in school, and we'll get to that point. Basically, yes, you're sensitive to light, right? No, I'm not sensitive to light. I have pressure in my head. My ears are pulsing. My body's pulsing. My head is about to explode. I have a history of intracranial hypertension, and basically they're not taking me serious. So while I'm sitting there literally crying, I get told to go sit back in the waiting room until I'm called again, in pain, heads blazing. Maybe about 30 minutes later, I'm called into like this little room. Well, not even a room, because it has no ceiling. You can hear everybody's information. There's no patient confidentiality at all. And there's just these curtains to close off when you're sitting in there. And they're like, well, the doctor's ordered you a concoction for migraines. And I said, this is not a migraine. I have a history of intracranial hypertension. I feel the same symptoms I felt in 2013. there is fluid on my brain. I need a CAT scan. I need a CAT scan. That's what I need. So I need a CAT scan and I need pain medication because I'm in so much pain. Again, at this point, I didn't realize I was COVID-19 positive. So, I'm not being taken seriously. I get a shot in my hip for tramadol, for a pain medication. She said, oh, it's going to take about 45 minutes to work. I'm like, 45 minutes? I've been dealing with this headache for a week. I need something like now. She's like, well, there's nothing else we can give you unless you want the migraine concoction. And that's what she called it, a migraine concoction. I didn't want that. Basically, from that point forward, I'm set back in the lobby in pain, like excruciating pain. I was called back into that little room again, maybe about 45 minutes later, and the doctor comes in there rushing, and she's like, oh, we're gonna need to give you a lumbar puncture. No, she said, we're going to give you a CAT scan. I said, oh, okay, we're going to get a CAT scan. So I go get the CAT scan. I'm brought back into the room again, maybe 45 minutes again later. And then that's when she tells me I'm going to have to get a lumbar puncture. This time she's like so urgent about helping me. Oh, we got to get you to the bedside. Dr. Stokes is going to do your procedure. We got to get this done immediately. And I'm just like, yeah, I've been telling you that maybe 3 hours ago when I'm sitting here in pain that I have fluid on my brain. And she's like, yes, it's called a empty sella, something empty sella. I never heard that mess before. It's something near my pituitary gland where it was filled. It's called empty sella, but it's not actually empty. It's filled with fluid, spinal fluid. So they tried to take me by bedside. I'm trying to explain to them, I've had a lumbar puncture before. It worked best if I did it under Flora, with radiology. They did not listen to me. They basically was telling me the fact that it didn't matter, that they were going to try to do it by bedside. With that, they've tried to perform it by bedside. I was basically a item for students. The doctor who performed the bedside lumbar puncture was very rude. He made comments about my size, my weight, and how things would work out best if I was a lot smaller. It was very demeaning and humiliating. He fished in my spine, and until I literally boo-hooed like a baby, like snot coming out my nose. I'm telling him, please stop, begging him to stop, telling him he's hurting me, and he was not listening to me. At one point, he yelled out to a nurse, just give her Ativan. Just give her Ativan. Just give her Ativan. So then I'm stabbed in my arm, literally stabbed in my arm, my right arm, with Ativan as I'm crying and begging him to stop. I'm listening to him allow two different people, I'm not even sure who's even behind me, two different people, he's telling them, okay, feel right here as I'm going in, how you have to go through the tissue of the spine. And as you can see right here, this is like, we're getting closer. And they weren't getting close to anything. They were hurting me. He did this. It felt like forever for me. I can't even tell you how long he played in my spine, but he did this forever. I'm going to have to go get my baby now, but I'm going to explain a little bit more, what it looked like for me when I tested COVID, when I found out going to the hospital the next day. I'm going to finish Saturday's experience, and then I'm going to explain to you what it looks like, when I actually found out I was COVID positive, and went to the hospital the next day. But I got to go get my baby now, who also, like I said, tested COVID positive because she was exposed to me, because she woke up. So, love you guys. Please advocate for your family. They're out here trying to give trial medications that have been approved for emergency use by the FDA. And there is no trial, like extensive trial experience with any of this medication. Warn your family. I'm going to give you a brief synopsis in what I'm going into on what happened to me Sunday and Monday when I was hospitalized. I felt that my information, my symptoms were manipulated in order for them to qualify me for a trial use of a medication called remdesivir. But I'll talk to you more about that. I gotta get my baby. I love you guys. Love you all. I'm doing great. I'm still struggling with the pressure in my head. You can see my eyes. Manageable at this point, but I can't even go back to the hospital because I'm too scared to after I explain to you guys what happened to me. So I'll talk to you later.